To all who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Releve Sports Medicine's Virtual Journal Club. For additional webinar, for additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Releve Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. RSM hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content, which is provided as is and without warranties. For all athletic trainers who are intending to get live CEUs from the BOC, you'll receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You'll have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once this statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the questions and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Our speaker is Dr. Daniel Clearfield, who is the founder and medical director of Motion is Medicine Sports Medicine in North Richland Hills, Texas. His practice focuses on osteopathic sports medicine, regenerative orthopedic medicine, non-operative orthopedics, osteopathic manipulative medicine, and concussion management. He did his undergrad at University of Texas in Austin, medical school at Texas College of Osteopathic Medicine, residency at Doctors Hospital in Columbus, Ohio, pre-doctoral fellowship and OMM at TCOM, and a sports medicine fellowship with Overlook Hospital in Summit, New Jersey. Dr. Clearfield is a nationally and internationally recognized speaker in the field of sports medicine, regenerative medicine, and concussion management. He covers numerous area high schools and area sports. He is an official team physician for the XFL's San Antonio Brahmas, USA Wrestling, USA Judo, and the US Olympic and Paralympic Committee. He has covered sporting events all over the world, most recently serving as the USA Wrestling team physician at the World Rankings Tournament in Tunisia, Africa. He is speaking today on coverage of the wrestling athlete. And we'll have you take it away.
All right, gotcha. Can you hear me okay?
Yes, we can.
All right, awesome. Okay. All right, so I am doing this lecture today talking about coverage. Oh, now I can see me. All right, we were trying to figure out how I could see me. So I'm going to be talking about coverage of the wrestling athlete. I have been working with USA Wrestling now since 2000. Well, I have it in my lecture here, but I was a wrestler myself, and so covering wrestling and working with our Olympic wrestlers, that was always my big intention when I discovered that I wanted to do medicine and sports medicine. And so I can talk a little bit about my path as far as getting involved in that as well. So I'll go ahead and I'll just kind of get started with the lecture a little bit here. So we're going to kind of go over just the different types of wrestling, notably just in the United States, because there, as I did some research into this, there's like a whole ton of different kind of wrestling arts kind of throughout the world. Understand the unique medical challenge considerations associated with wrestling, and then learn to triage and manage some of the common wrestling conditions. So as far as the financial disclosures, I wish I had some to disclose. I am an official team physician with USA Wrestling, USA Judo, and the US Olympic and Paralympic Committee. Just my roadmap. So I wrestled back in high school many years ago. and I had lots of injuries. And so to the point that it's rare that I see something that I haven't incurred myself. And being in my mid 40s now, I am feeling the wrath of all the abuse that I did to my body as a wrestler, notably, and then a little bit further, just kind of in my 20s and everything like that. I've been a team physician with USA Wrestling ever since 2012. I did my Olympic Training Center rotation back in 2013. My first international trip with USA Wrestling was in 2014, and I got to go to Paris with them, which is pretty cool because my wrestling mentor in the sports medicine, he's been involved with USA Wrestling about a decade longer than me. His first trip was Siberia, and it was like minus 100 degrees there or something. And I have since been there, and it was quite cold, but that was my first trip was Paris, not Siberia. I got to work the, probably one of the coolest events I got to work was the Pan American Olympic Games in August 2019, and that was in Lima, Peru, and I have some photos from that event. When the Olympic trials happened back in 2021 in the midst of COVID, I got to be the medical director for that, which was also a very cool opportunity and honor. And then I did the World Rankings tournament back in 2022. And so we have the Olympics coming up this year. Unfortunately, I was not selected. There's about probably a dozen of us physicians that are team physicians for USA Wrestling. And so it kind of goes a little bit in a round robin. There definitely is a little bit of certain kind of biases that some of the coaches might have. And there's definitely some nepotism because the doctor that was selected in for the 2020 and 2016 games, same guy, his brother's on the national team. But that being said, so we're I'm just going to go ahead and cross my fingers for the 2028 games. At the same time, it's like I have a very busy practice that I'm running right now, and if I got pulled out for the Olympics this year, that might have been a really hard hit for me because all these kind of neat things that I do with USA Wrestling, these are all volunteer. Just as many of you that are on here, I'm sure, just kind of volunteer at a lot of different kind of events. And so it's great to add to your CV and pad your CV up with it, but I feel like my CV is pretty well padded at this point. And so it's more of like, okay, I'm losing money while I'm kind of at these events. So it needs to be a pretty cool thing for me to want to kind of miss it. So that being said, let me just kind of talk a little bit about the types of wrestling. So if you watch Olympic style wrestling, then you're going to see freestyle and Greco-Roman. That's our Olympic. And so freestyle is going to be most close to, if you watch what's kind of happening in high school and college, and typically, at the lower levels of, the beginning levels of competition, that's where typically we're seeing that folk style, also called collegiate or scholastic. And so freestyle is going to most closely mimic it, but there are some different rules as far as how scoring is done, amplitude of throws, and so the rules are definitely a little bit different between freestyle and folk style. I will say that freestyle and Greco-Roman are really about action and trying to make sure that action is continuously happening, where there can be, it can sometimes be a little bit slower in regards to folk style. And every country has their own respective style of folk style. And so that's where, just because you are a national champion in collegiate folk style, you might not be good enough to be a freestyle Olympic champion. And at the same time, sometimes you can be a freestyle Olympic champion and you never won a national title. And so that's where every now and then, but I guess we see that with football every now and then, like sometimes you see a football player that just never really broke through in college and then they are highly successful in the NFL. And so, but in wrestling, some of those skills definitely transfer well, but some athletes really find their niche within a specific thing. I personally, I felt like I was always a better freestyle wrestler than I was even at folk style or Greco-Roman, but I always placed better at the state competition in Greco-Roman. I took third in state, 2 years in a row in Greco-Roman, where the highest I ever placed in freestyle and folk style was fifth. And so I was just better because I was a top heavy guy that was really good at throwing people. And so I did well with that. Sumo wrestling, I put that on there even though it's not a traditional US, but we're aware of sumo wrestling. As far as that dominance within the ring, there's a little bit of overlap, but absolutely it's a different style of wrestling. Then there's professional wrestling as well, and notably there's WWE, and then more recently AEW, All Elite Wrestling. I have actually had opportunities of working with both of those as well. A couple of my sports medicine mentors, they have been some of the team physicians for those respective things. When I was in my sports fellowship up in New Jersey, I got to cover a lot of WWE events in the tri-state area, and so got to go to New York and New Jersey and Philadelphia and other places and cover some of those events, which was really cool, and I have some fun stories from them as well. And then I just threw on arm wrestling because, hey, you know what? It's a type of wrestling. I'm seeing it actually, whatever reason, that has made its way into my TikTok algorithm, where I'm seeing arm wrestling all the time right now, but different kind of wrestling. But you know what? I'll just throw that on there. It's a type of wrestling. I'm mainly going to be talking about our collegiate, folk style, and Olympic style wrestling in this lecture. This is from my first assignment in Paris. So this is the Paris Grand Prix tournament. This is me with the women's team over at Notre Dame. This is back in 2013. What's pretty cool about this is I look at this picture and, you know, our coach is still the same women's coach, but a lot of these wrestlers that were on this trip are now coaches themselves. So they have really kind of ascended through the ranks, and some of them are still competing, but some of them are actually coaching now. Here is me doing OMT on a wrestler over in Russia. And so this was actually at that Siberian tournament that I was kind of mentioning. The wrestling mat is actually a very good mat for doing osteopathic manipulative treatment, just as far as the thickness and the hardness of the surface. It's just hard enough that I can actually do OMT really well on it. Here is me facing off. I was a Longhorn, so you know, Longhorn wrestling was not really at my college. It was just available as a club sport. But Oklahoma, well, I almost went to Oklahoma to wrestle, but then I ended up defecting over to University of Texas and getting brainwashed. And so the hell with the Sooners, they can go to hell. So this is one of our OU wrestlers that was at the tournament. And I faced off against him head on, and I'm sure, as you know, I just destroyed him. One thing that is a lot of fun when you work some of these events is if you work an Olympic event, you need to be pretty hands-off with the athletes, give them their space. But if you work just a USA Wrestling event, I can drill with the athletes, I can train with them some. They say don't accidentally hurt them, but at the same time, I can actually treat them if I do accidentally hurt them. But more likely, they're going to accidentally hurt me. But it is really cool being able to kind of go out there and train with the best athletes in the world. And so if you ever feel like you need to be kind of knocked down a few steps, if you think you're like, oh, you know what, I'm getting in pretty good shape. When I was in Russia, I was training for a marathon. I was actually in pretty darn good shape, and I got served up some humble pie really quickly. This guy was about 25 pounds lighter than me. And his strength, his functional strength was just insane, and he just manhandled me. This is me over at that Ivan Uragin tournament over in Russia. It's one of the most prominent tournaments every year. This is the one, again, it's in Krasnoyarsk, Russia, which is north of Siberia. I had no idea how big Russia was until I flew out there. And then, it's like pretty much Krasnoyarsk is, if you take a flight from Moscow, it's pretty much like going from San Francisco to New York to be able to get there, and you're still only like halfway across Russia at that point. Russia's just insanely large. And I will get to some actual medical stuff, but it's just fun to kind of show some of the experience with it as well. So this is the Pan American Olympic Games. Here's me outside with the women's team, over at the mat side over here. Posing, we had that's Randy Boswell. He's one of the athletic trainers that I've worked with a couple of different events. And here's me with a couple of our wrestlers. Sarah Hildebrandt, that is directly next to me. She is going to be representing Team USA again at the Olympic Games this year. So really hoping that she gets her gold medal this year. This is us back in the training room, part of our medical team. So the athletic trainer, we had a couple of athletic trainers there. We also had a massage therapist that was there with me. And a couple of our gold medalists from the Olympic Games over there. This is me doing, I actually really think this photo is very cool because this is me doing OMT on one of our bronze medalists from that event. But I have two gold medalists, Kyle Snyder and Jordan Burroughs, watching me. So they're both, world champions and Olympic gold medalists. kind of watching me do this, and here's me doing a little bit of manipulation on Kyle Snyder. I will say that being a DO that does a lot of OMT has been a huge leg up as far as getting opportunities with USA Wrestling, because I can offer stuff besides just a pill to be able to help the athletes. Especially when you're working with Olympic athletes, they are afraid of taking a Tylenol just because they're afraid it might be laced with something that they could test positive for that's going to disqualify them from any kind of future events. And so if you have something that is non-prescription, non-pill, something that you can actually do for them rather than just give to them, they're always very appreciative. And so manipulation, being able to help people with my hands to seek wellness within their own body, they really appreciate that. And that's given me a lot of opportunities. And it's been a huge rapport builder for me with our national team. I could definitely say that. This is me with Tamara Mensah Stock. She is my favorite athlete on our team, but she actually has defected over to the WWE. One of our biggest threats in USA Wrestling is defecting over to UFC, mixed martial arts, or to professional wrestling with AEW or WWE. And part of it is just money-wise. The Olympics, unfortunately, just don't have a lot of money to support our athletes. So a lot of our athletes have to find outside sponsorships. They have to work extra jobs. And so can you name our last Olympic gold medalists in men's and women's wrestling? Probably not. But can you name like who the WWE champion is or the UFC champion? And there's a better chance that you can do that. So there's some more money opportunity there. So Tamara, she did very well. She actually won the Olympic gold medal at the 2021 games. She was one of the hits of the 2021 games. She's also a fellow Texan. She's from outside the Houston area. Total trip, super funny, super hilarious. Also, just a total ditz. And so one of the fun things was Nike is USA Wrestling and just the Olympics kind of a supporter. And so they provide Nike gear for us for these events. She won the gold medal and she needed to get up on the podium, and she was wearing her Adidas shoes. And so she needed to figure out somebody else's shoes. So we all had to play Cinderella and take off our shoes. And I took my shoes off and they fit her. So this is her actually on the podium getting her gold medal, wearing my shoes. And then once we went back to the locker room afterwards, I took photos of her and the gold medal and me, and then I took photos of my shoes with the gold medal. And actually, I have those shadow boxed in my office now, my gold medal winning shoes, because I thought that was just a kind of a fun thing that I had from that event. This is actually in Canada at the Olympic qualifying event for the Pan Americans. This was in 2020. March 2020. So this was right when everything was about to hit the fan with COVID. And we barely got back into the US after this event. And then that's when COVID really started getting bad and everything kind of shut down directly after this. So I got to kind of do this event, and then the world kind of went haywire after that. But this is me kind of working that event, doing some OMT on some athletes. At Kyle Snyder, with Kyle, before he had to kind of do drug tests. Anytime they win a gold medal, they always have to do drug testing. And me kind of holding my shoe next to Tamara holding the golden shoe because she was the outstanding wrestler for the tournament. Our men's team and women's team both won the overall team title. So here's me posing with the men's team. That's me right there. All right, so I'm not talking about me working with wrestling. Let's talk about what happens with wrestling. So wrestling is a great injury. It's also a very sadistic and masochistic sport. I will say I kind of enjoyed the abuse masochistically, and I enjoyed doling out the abuse as well. I used to, with what I do now as a sports medicine physician, and notably as an osteopathic sports medicine physician, is I used to look at my opponent and I would study them. I would look if they were hobbling. I would look if they were taped. I would look if they had cauliflower ear on one side versus the other. It helped me strategize about how I could exploit my opponent. I would try to see where their injury is. I would try to predict how I could. So I'm like, okay, they are injured over on this left knee. I'm going to make them put weight on that. And then I'm going to shoot in on that, and I'm going to make sure that they can't support themselves. If I saw that they had cauliflower ear, I knew that they were going to be ducking under on that side, so I was strategically going to make them go against the grain and circle them the way that they weren't comfortable, to put them in a position of a defense rather than offensive. And so I learned to kind of study my opponent so I could exploit whatever their injury was when I wrestled. Then I went to medical school, and notably osteopathic medical school, and we started looking at, we did the same kind of thing in our manipulation lab. We would kind of look at our athlete, or we would look at our patient, and we would study them, and we'd say, how are they limping? How are they doing this? How are they carrying themselves? And then we try to figure out what we can do to kind of correct that. So I was like, oh, I'm already really good at this, because rather than doing it for evil, now I'm doing it for good. And so pretty much I just took a 180 on what I was doing as a 180 is what I was doing as a wrestler, and I was able to directly apply it to looking at somebody, trying to figure out where their injury is, where their vulnerability is, what's wrong with their kinetic chain, and how I can kind of help it. So along those lines, lots of injuries that happen with wrestling. So we see lots of things like sprains and strains, very common. We think about like, notably, there's a lot of knee injuries, a lot of finger injuries with kind of grabbing at things. A lot of knees getting hyperextended with people being shot in on and getting the knee kind of hyperextended, lots of ankles getting cranked on, lots of fractures and dislocations as well. And notably, depending on the level that you're working, you're going to see, if you work, I've worked several different kind of like varsity tournaments and collegiate tournaments and national tournaments, and yeah, I'll see some injuries, but usually they're not too bad. I always say, if you want to see some really good orthopedic injuries, work a junior varsity or a freshman, one of these kind of fresh kind of leagues where somebody hasn't had as much experience. One of the first things that we learn in wrestling is how to fall, how to be thrown, how to land. And so if somebody picks you up, a lot of times your reflex is, I need to stick my arm out to catch myself. And in wrestling, you learn that is a no-no, because that's where you're going to break something. You're going to get a clavicle fracture. You're going to get an elbow dislocation. You're going to get a wrist fracture. And so JV tournaments, you're going to see lots of these kind of orthopedic kind of injuries. That said, I have seen numerous dislocations. I see a lot of, notably, I've seen lots of shoulder dislocations, lots of elbow dislocations, and lots of ankle dislocations. I have seen a knee dislocation. I've seen some patellar dislocations, but an actual femoral tibial dislocation, I've only seen one of those with wrestling. I've seen it with some other sports. As far as hip dislocation, I've seen one of those as well, not very common there. I've seen lots of finger dislocations. I've seen thumb dislocations. The first thumb dislocation I ever had to put back in was actually an OU wrestler that I was covering at a collegiate tournament. So I, despite his, wearing his crimson, I still helped him out. And he actually, it was funny. I popped right back in. He's like, okay, thanks. And he just went right back in and wrestled again. I was like, okay. I didn't even have time to tell him about precautions. He just ran right back in there. So, so a lot of these kind of things that we can see. And so making sure that you're comfortable as far as being able to kind of manage these, knowing what to kind of do, knowing when there's going to be, when you need to do something emergently. One thing that was really fun was my wrestling coach, who's been one of my mentors and friends now since high school. He was the coach out at a different high school that I was then working as the medical director of a tournament there. And we were just sitting there just talking, kind of shooting the shit and talking about things. And literally right in front of us, one of the wrestlers got thrown down, dislocated his elbow. I went out there and he actually had vascular compromise. And I was like, oh my God, this kid could lose his limb if I don't get this back in. And I got it right back in. And fortunately, the kid did great. We didn't need to transport him. I was able to monitor him from the tournament and was able to actually have him follow up in my office. And he was able to get back to wrestling even later that season. So it was a great outcome from something that could have been very disastrous, especially if we had delayed care for that. So a thing that I always like to say is, if you're prepared for everything, then you're surprised by nothing. So it happened. I was able to kind of get it back in, and I knew what to do with it, and he did fine. So let's talk about concussions. So concussions definitely happen in wrestling. The one thing, just from, I personally have had 9 concussions myself as an athlete. 7 of those concussions were athletic related. 2 of them had nothing to do with athletics. And 3 of those athletic related concussions were from wrestling. One of them was I picked a guy up and he cross-faced me really hard, which is a defensive move where you essentially take your hand and you try to peel their nose across their face to their ear. That's the way it was kind of instructed on. You can't punch them, but you can try to drag it across to create space in between the body so that you can get in a defensive position. It led me to pretty much, he came down, his knee came on top of my head. I got knocked out for a period. I got really upset because this was my revenge match against this guy. And so I was able to beat him a little bit later in the year. But that definitely stunk because he ended up winning that tournament and I was the picked to win that tournament before that. I had 1 concussion that was totally my fault. I lost a match that I shouldn't have. I had already broken my hand punching a wall because, I'm an idiot boy with a Y chromosome. And so I'm like, I'm not going to be stupid and do that. So I smacked my head against the wall instead, and I gave myself a concussion. I actually, this was back in the 90s, and, where concussions weren't cared for the right way. Told my coach, I don't feel good. I feel really nauseous, feel like I'm going to throw up. And he's like, well, I don't care. You better get back in there. And I had to go out and wrestle again. I wrestled a full 6 minutes. I remembered about maybe 2 of those minutes. It was like the Futurama episode where they kept kind of blanking through time. I would take the guy down and then I would black out, and then all of a sudden I was on the bottom. I would reverse him and I'd black out, and all of a sudden I had been reversed on. I was pinning him, I would black out, all of a sudden I'm on my back getting pinned. I remember little bits of that match, and I remember I ended up losing by 1 point, and it went all 6 minutes, and I kept blacking in and out throughout the entire match, and it wasn't stopped. So, the hope is that we have much more better awareness as far as what to do with concussion now. When in doubt, we sit them out. We need to pull them off. At the same time, if you pull a football player off, even if it's the quarterback, guess what? There's a backup quarterback, somebody else that you can put in. Wrestling's an individual sport, so if you pull them off, you're pulling. I mean, if it's a duel, okay, they're just maybe losing that specific match within the duel as part of the team. But if it's an individual participating in a tournament, if it's the state tournament, national tournament, the Olympics, it's a huge deal when you need to pull them off. So you really need to have a better idea about, is this truly a concussion? Is this something that we really need to pull them off right now? And so that's something that you really have to get comfortable with as far as a very quick, rapid assessment to be able to kind of do on the mat, see what's kind of going on with them. Do they look glossed over? Did they black out? Do they seem unsteady on their feet? Are they confused? Are they able to converse with you? Really trying to get to the bottom of that very quickly, because you need to make a decision very quickly. This is Dr. Mike Sampson on the left over here. He has been one of my sports med mentors ever since 2004, and he worked with WWE, so he's the guy that I got to work with WWE. He is actually the head team physician for AEW now, and so he does a lot with AEW wrestling, and actually I've gotten to work with him with AEW as well. So great guy, and a lot of fun. He worked a lot with Virginia Tech wrestling back when he was at Virginia Tech. And then he works with all the professional wrestlers now, where we've actually had a lot of our collegiate and folk style wrestlers and Olympic wrestlers defect over to that as well. Let's talk about bleeding, okay? So this is by far, the biggest injury that I see. So my thing that I always like to pimp the medical students with on the sideline is, what do you think the biggest injury that we ever see out here is? And they'll all say it's like ACL or ankle sprain or this. And the quick answer is feelings, because 50% of the athletes out there are always going to get butt hurt because they always have that intention that they're going to go out there and they're going to win, and half of them aren't going to win. And so that's going to be the biggest, most common injury that we're going to see. But you know what? Maybe bleeding in wrestling actually exceeds hurt feelings, because not uncommon that we're going to see 100% of the athletes on the mat have a bleeding kind of issue. They smack heads. Over here you can see like a really bloody nose kind of taped over. This is pretty much in an extreme where we're trying to kind of get the nose plugs really kind of held inside there. Then you see the other athlete with his head wrapped to probably cover up a gash, laceration, abrasion that he has on his head. So we see lots of cuts, lots of little things on there. Epistaxis, nosebleeds tend to be a big one. There's a thing called blood time in wrestling where it's outside of injury time, where you have X amount of time, depending on the type of wrestling sport that you're covering, to be able to get control of that bleeding. And so you have time to be able to get control of that bleeding so that the wrestler can get back as quickly as possible. That's one of the big arts of sports medicine as far as being out on the wrestling mat, is making sure that we can get that athlete back there as quickly as possible. I can tell you that working internationally with USA Wrestling, one of the Russians' tricks is to frustrate the US by finding different ways to get them to bleed, and then allowing, because a lot of times our athletes are in much better endurance-based shape. Our athletes, if they just had to go hard for a full 6 or 7 minutes, our athlete is going to be able to defeat them anytime. But what they do is they try to find a way to be able to get a little bit of a relaxation break, and so they try to make them bleed. And so they find any kind of way, and then the second they cut, they try to exploit that and try to get that to reopen again. So we have to get very quick coagulation, and so there's lots of different tricks that we have for that. So before I go out and I work any wrestling event, I always will take a little baggie, and I will take some of those dental rolls or nasal tampons, and I will take some Vaseline or triple antibiotic ointment, just something that's kind of petroleum based, and I will just kind of lube those up, each one just individually, just make sure it gets kind of covered. And then I'll take some Afrin, some oxymetazoline, that's a potent vasoconstrictor, and I will spray each one of those down and keep that in the bag. In the extreme case, sometimes I'll even open up a vial of epinephrine, and then I will put that in the bag and mix those up with the epinephrine as well, because that's going to be that much stronger of a potent vasoconstrictor. And so you can use those little nasal plugs to be able to plug up any kind of epistaxis if you have it. You can use that for also helping on any kind of abrasions. You can use that to help kind of get, or lacerations. Notably, if you have the epinephrine on there, that works very well to be able to do that. But there's other things that you can use as well, like Moncel solution, silver nitrate. But keeping in mind, if you use that on the skin, on an area that cosmesis is going to be important to you, you're going to give them a scar. And so giving them a heads up about that. And also, if you want to piss somebody off, silver nitrate burns like hell, but it does work really well as far as getting some good rapid coagulation. So lots of different things that you can do. The other thing about wrestling that I wanted to talk about with bleeding is wrestling usually happens with the perfect storm of environmental and physical conditions to encourage bleeding. Wrestling is typically a winter sport, but it's done inside. And so if it's cold outside, guess what? The heat's on inside. So it's already a warm environment. And then we have a wrestler who is typically dehydrated because they work themselves to, skinny death. And then they're also a lot of times undernourished because they are cutting weight. And when they're undernourished, they have less circulating proteins, including coagulation-based proteins. And so they're more susceptible to bleed because of their protein. They're more susceptible to bleed because they're dehydrated. They're more susceptible to bleed because it's a hot environment where the mucous membranes aren't going to be very moist. So you really have that trifecta of different factors that really enhance the ability to bleed. So, and then you also have risk. So my nose was definitely my Achilles heel when I wrestled. Amongst my many injuries, I have had 20 nose fractures, and I've had 14 of those fractures occurred from wrestling. I've had 2 septal hematomas also, and septal hematoma is my second septal hematoma I had was my 10 out of 10 pain moment. I thought I was going to die. Pretty much the quick story with that was I broke my nose on like a Friday and reset it, wrestled through the weekend at a tournament. I had practice the following week, and our coach threw our heavyweight, and our heavyweight was a bodybuilder also, kicked me almost point blank right in the nose. Just one of the worst nose break of those 20 nose breaks, one of the worst ones I had, if not the worst. I felt crunch, 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 but I was just used to, again, I was masochistic. I was used to kind of just taking the abuse, and I just snapped it back, and I just kept wrestling. That night I woke up with, and I still don't know if it was pain that was just blinding pain so I couldn't see, or if this hematoma was so large that it was actually pushing on my optic chiasm. but I could not see, and I was in so much pain. I was screaming. I thought I was going to die that night. And so that was my absolute 10 out of 10 pain moment. Had to be rushed to emergent surgery to have that evacuated. And then at that point, I pretty much had to wear one of those face masks for the rest of my wrestling career, which was lots of fun. And then I had my nose finally fixed. So anyways, lots of fun bleeding things that can happen both inside and outside with wrestling. Let's talk about skin infections. And, you know, it's like I also give a lecture on dermatologic conditions in athletes, which is pretty much a wrestling lecture, just because there's so many different kind of dermatologic conditions. Wrestlers are just, I mean, there tends to be a lot more skin showing. Again, wrestlers are typically a little bit undernourished, so their immune system's a little bit compromised. And then also wrestlers sometimes are not the cleanest people. So if they're not bathing well, they can definitely set themselves up for that. But lots of little cuts and stuff like that can have slight insult to that superficial immune system in our skin. And so it makes you a little bit more vulnerable to some of these things. So bacterial-wise, we'll see things like cellulitis, folliculitis, impetigo. We see community-associated methicillin resistance, Staph aureus. And so that can be definitely some of the more serious kind of bacterial things that we're going to more commonly see. And I'll talk about the clearance guidelines on that in just another slide. From a fungal standpoint, we talk about like some of our tinea kind of things, and notably tinea corporis, also tinea capitis. So tinea corporis, also known as tinea gladiatorum, is going to be so our ringworm. And, you know, I was able to, I never had any kind of bacterial infections when I wrestled. I did get ringworm, and I got that right at my junior year at the very end of the year. I remember last match of the year, I finished up, shook hands with the guy, and he said, by the way, I have ringworm. You might want to get that checked out. I'm like, thanks. And sure enough, I did get that. Season ended in February. I have ringworm all over my body. I was in some fantastic shape, and we went on a family cruise a couple weeks after that. And I didn't want to take my shirt off because I had all these extra nipples all over my chest. And so it was a traumatic experience for me. It's a difficult condition to treat too. It takes a long time to kind of get some of these fungal things to be able to be cleared. So in general, we do skin checks. So we do skin checks before the competition to make sure that we're not going to have any kind of infectious outbreak of anything. And sometimes we do need to be able to, you know, pull the wrestler out because of that. So that's where, from a preventative aspect, if you're out there working with a specific team, doing a skin check prior to travel, prior to kind of going out to things, making sure that you're really looking at all the different areas that we might see it, looking through their hair, making sure that you're kind of looking in the, you know, in the axillary folds, in the inguinal folds, any of these kind of high yield areas that you might be able to see some of these kind of things, because if you see something, recognize it and treat it before it becomes a big problem, then you can spare them and the team the possible need to be disqualified from the tournament. So that's going to be a big preventative kind of thing. But then we can also reactively treat these things. From a viral standpoint, you know, we talk about herpes simplex, also called herpes gladiatorum. It tends to be an activation of HSV type 1, not HSV type 2 that we typically see with genital herpes, but more type 1 that we see with like cold sores, but we can see it on anywhere in the body. And I have some pictures of that as well. Molluscum contagiosum also is one of those that not uncommon in the pediatric population and actually pretty common in the wrestling population. It is one of those things that can preclude you from being able to participate because it is extremely infectious and able to be spread. And so if you don't contain it, it can spread like wildfire through a tournament. So this is a picture of a you know, really bad herpes gladiatorum, okay, on this guy right over here. So in general, if we have a viral lesion, and you know, there's some general rules between it. They're a little bit different between NCAA and NFHS, but in general, it's a 72-120 rule. So no new lesions for 72 hours before the examination, and treatment with antiviral therapy for at least 120 hours, so 5 days. So you want to make sure that there's really an adequate amount of antiviral therapy that's been done systemically to allow them to be able to kind of fight this off. And so typically you need to do something like a valacyclovir or acyclovir to be able to treat this. And you want to make sure that there's been no new lesions, and then any other lesions are kind of crusted over or adequately covered if they kind of met these other criteria, if they're going to be allowed to be able to participate. From a bacterial standpoint, so then we talk about this 48-72 kind of rule. And so no new skin lesions for 48 hours before competition, and completed at least 72 hours of systemic antibiotic therapy, or if it's impetigo, it might be topical antibiotic therapy. But want to make sure that, again, lesions are kind of crusted over, there's no new lesions kind of forming, there's nothing weeping, nothing that's potentially going to be able to be spread to anybody else. And so that's the big thing. And so some athletes will try to find a way to conceal it. They'll say, oh, well, I have this taped up around here, you know, because I hurt my elbow. But it's like, for a weigh-in, you need to take all that crap off, because guess what? They hide stuff. They hide stuff. So weight-related issues. And I will say, you know, when my sophomore year was the first year that I wrestled, and just the date we celebrated this year, 2024, is the 30-year anniversary of me starting my high school wrestling team. I was one of the founders of it, so it's just crazy that it's been 30 years. When I first started, I was a 119 pounder, so I'm definitely a little bit heavier now. When I was a 119 pounder, in one practice, I lost 14 pounds. 14 pounds in one practice at 119 pounds of a wrestler. Most of that's weight, most of that is very quickly gained back, but you know, I would wear layer upon layer of sweats. Now, there are some people that like would wear plastics, but plastic, you know, wearing like trash bag plastic kind of suits was granted to be illegal, and I didn't do anything illegal, but I worked my butt off with everything that was legal. I would try to just see, it was just part of the culture, how much weight could we lose? We've definitely learned to kind of do better with this, about learning how much a wrestler is allowed to kind of cut weight. When we do these preseason weigh-ins now, we'll do a urinalysis evaluation and body composition analysis, so that they can make a more better judgment about how much they can safely drop or kind of ascend up as far as weight class wise, so that they can't make any big drastic changes. And so like this right here, 1.5 pounds in 20 minutes, not an uncommon kind of thing in wrestling kind of culture, that we would just very quickly try to just drop weight very quickly. Dehydration is a huge one. We used to try to see who could go without water the longest in practice, or just in general. My junior year was the dumbest year that I cut. I had a growth spurt. I was a 130 pounder most of the year, my junior year. I had a growth spurt over winter break. I really probably should have wrestled 135 or even 140 at that point, but I insisted on cutting weight and making it to 130. Before the regional tournament, which I was picked to, go advance to state that year, I did not eat anything for 3.5 days. I did not drink anything for 3.5 days. I walked around with sunflower seeds in my mouth to soak up any moisture, and I would spit those out into a cup, and then I would just, and I still trained like a demon. And so, and idiot that I was, I weighed in 1.5 pounds under. I weighed in at 128.5. And then I was so drained of energy by the time it was time to actually compete that I didn't make it to state that year. I took fourth that year. And so it was just one of those things where it's like, just such a stupid kind of thing. We've gotten smarter about it, but we still see these kind of things happen. So dehydration, and this isn't unique to wrestling. It's unique to any sport where you have to kind of make a weight. And so whether that be bodybuilding, whether that be powerlifting, whether that be mixed martial arts, or sometimes even cheerleading or gymnastics, you might see some of these extreme kind of behaviors as far as when you think about somebody with an eating disorder, you typically think about like your gymnast or your cheerleader or something like that. But there's definitely a lot of eating disorders in the wrestling population. And so the relative energy deficiency syndrome, REDS, is definitely something to be concerned about, notably when you're seeing recurrence of injury in a wrestler, just because maybe they have an eating disorder. I wouldn't say that I was full-blown anorexic. I was never bulimic, but I definitely had some traits of anorexia when I was wrestling. as far as when you look at some of the criteria for it. I didn't meet all those criteria, but I definitely had some of them, notably my junior year. And then I got smarter my senior year, and I cut weight appropriately my senior year. So as far as treating things like auricular hematomas, so we kind of talked about other hematomas, but so auricular hematomas tend to be because of the shearing kind of force when you are, big thing about wrestling is you want to make sure that you have as little distance between yourself and your opponent. So a lot of times your head is very much pressed against them. You can wear headgear, but some people don't like to wear headgear. Some people consider that, notably in places like Iowa, that having something like a cauliflower ear is a badge of honor. It shows that you are a wrestler. It shows that you're a grappler. It shows that you've kind of competed in that. But that said, some people don't care for this. So the acute phase of this is auricular hematoma, and that's where you bleed in between the perichondrial layers of the ear, and it will get all puffy and swollen, kind of like in that bottom left right over there. Typically, it starts to kind of organize into like damaged collagen and scar tissue within about 7 to 10 days after that's kind of occurred. So really you have that first week is the big part that you have a good window of time to be able to actually physically drain it. I actually find that if I can scan it with an ultrasound device first, I can see all the different little compartments that I need to kind of go into, because sometimes they're in little different separated off compartments. And then I can plan where I need to kind of drain each little area. And you can drain it either by just doing needle incision and draining it out that way, or you can actually make an open incision, but you definitely increase the amount of risk for any kind of infection and other kind of complications when you do an open kind of incision. And then one of the big things is you need to pack it. And then the question is, are they going to keep competing afterwards? And so typically, if you're going to be draining it and then you're going to be packing it, usually they're done competing until you've had a chance to allow that packing to kind of stay. Why is packing important? Because just like draining any hematoma, it has that risk of reaccumulation. And so that's where you want to have a really firm kind of packing that really kind of seals those perichondral layers so that it's not going to reaccumulate. And so that is part of the art of managing these type of things as well. So lots of different ways that you can go about doing that, and that could be done again in a whole separate lecture. As far as treating things like laceration repairs, and this is one of my sports medicine fellows taking care of one of the wrestlers at one of the USA Wrestling events that we had over in Texas. We definitely see lots of blacks, so just making sure that you can sew those up quickly and make sure that it's not going to be something that's going to impair their ability to be able to get back out on the mat. So in conclusion, wrestling, it presents unique medical challenges, requires a multidisciplinary approach for prevention, management, treatment. By addressing common injuries, emphasizing prevention, being prepared for everything, then you'll be surprised by nothing. So just some other photos. So this is the Olympic trials, which were held in Fort Worth, Texas. So it was in my backyard. Again, this was during COVID, so we had our masks. This is me and one of the other physicians. He has worked so many different USA Wrestling events over the world. This is my buddy from med school who he went to Penn State, and he's always lived vicariously through my sports medicine career. And I was able to get him to be able to come out and work the Olympic trials with me. So that was really fun to be able to do that with him. This is our medical team that we had for that event. This was me over in, this was Tunisia, Africa. Yeah, so this is Tunisia, Africa. So this is a view from my hotel room. I'm smiling there right when I got there. Because I was part of Team USA, they deactivated our air conditioning in our room. That was the most humid place I've ever been. And I've been to Houston many times and Orlando. It was so ridiculously humid. I would step out of the shower, open up the door, and there would be like no difference. I didn't untuck my sheets the entire time I was there, and I slept out on the beach one of the nights I was there because it was so freaking hot. Great tournament otherwise, but oh my gosh. And then I also got COVID at the end of it, so that was fun. One of the wrestlers won a gold medal, and I stole it and ran off and took a photo with it a little bit. I did return it. Here's me with our men's head coach, Bill Zadek, and then And then this is Cale Sanderson, arguably one of the best wrestlers of all time, and he's the head coach at Penn State, and arguably one of the the best coach of all time now. So just amazing kind of guys that I've gotten to work with. One thing that's been cool, it's like, I've worked with professional athletes. I've worked with, athletes of all different levels. People ask if I've ever like kind of fanned out on anybody. And, when I first started working with USA Wrestling, working with some of these guys, I used to have posters on my wall. That was just like, all of a sudden I'm sitting there across the table sharing dinner with them or whatever. And I'm just like, this is just such an amazing experience. And, none of these guys are divas. All these guys are just amazing people. They're happy for you to be there, providing them medical care. And a lot of them just have, some great stories to tell and experiences that you can kind of learn from with what they've done. And so just great people to be able to kind of work with. This is me doing an OMT on Helen Maroulis, who was our first ever women's gold medalist. And so, again, just got to work with some very cool people over the years. This is my 4 kiddos. I have kiddos from all ages. So this is Disney a year and a half ago. My oldest is about to go to college herself, and my youngest is 3.5. So I have if I look tired, it's because I definitely am. If you're interested in following my practice, our handle is @MotionIsMed, and we're on all these different platforms. And so with that, I will see if there are any questions for me. Are there questions, or is there a ability for Q&A or anything like that?
We'll give people a couple minutes to see if they put any questions into the question box. If they do, I'll go ahead and read them out for you.
Okay. Or am I able to see that? I can't see that, or I don't know where to see it. And I think I added everything back in, but I actually had, I had this all like prepared, and then I had like my computer at my office like crash on me, and when I started back up, all the stuff that I had was gone. I was like, how the heck? I thought it's, and so I had to like recreate some slides, and I like the bleeding slide, I actually sent that over, and I was like, oh my God, I forgot to put the bleeding slide back in, and so I had to like quickly add that back in. And so I think I covered everything that I wanted to talk about. But again, if there's any other questions or things you need to know.
The first question comes from Dylan, and he asks, well, I guess, or she, but what's the funniest home remedy you have heard from one of your wrestlers for skin infections?
Home remedy?
A home remedy for skin infections.
For skin infections? Well, I mean, it's like, after my Big Fat Greek wedding, everybody's like trying Windex and stuff like that. I have not seen Windex be an effective remedy for that. I've actually had people that have like there was a coach that swore by gasoline. Gasoline. I don't know what the hell he's trying to treat gasoline. I'm trying to think if there's any other home remedies. I'm sure I can think of something else. But yeah, one thing about wrestlers is there's not many of us that really ascend into a higher level of cognition. It's like the best wrestler on my high school team was the reason that we didn't win academic all-state. It's like, so some wrestlers are really smart, but I would say not all the wrestlers, and definitely not all the wrestling families are really smart. And so some of them have some just crazy ideas about what needs to be kind of done for this or that. And granted, I'm a Texan, and so if you go up to Oklahoma, I could dog Oklahomans all the time about some of their crazy remedies and ways and everything like that.
So the next question was going back to something you had presented earlier. They said, what was your blood mixture that you said worked great for cuts and abrasions?
Yeah, so I'll get those little nasal, those little dental rolls, those little nasal tampons, and I will usually put some petroleum jelly on it or some triple antibiotic, just something that is petroleum based, just to coat it, and then I'll spray it down with some oxymetazoline, like Afrin, and then if I really need it, then and if I have like normally if I have it like an epi vial that maybe is kind of expired, so we shouldn't be using it. But I'll just keep that in my sideline bag after it expires, and then I'll just crack that open and mix that in there as far as my little dish, and then that tends to work really well for a lot of those things.
Okay, and the last question here is from Nadine, and she asks, are you saying after 72 hours of antibiotics with a diagnosis of impetigo, an athlete can return to practice?
So it needs to be crusted over. It needs to be, make sure that there's no new lesions. And you need to make sure that, yeah, you have that 72-hour kind of treatment phase. So it needs to kind of hit all those different criteria.
Awesome. All right, great. Well, thank you so much for attending to those who attended tonight. Thank you very much, Dr. Clearfield, for a great presentation, and certainly, especially given the IT technology malfunctions that you had going on. Very much appreciate everyone's time tonight. And any last words from you, Dr. Clearfield, before we finish?
I'm good. I'm good. I'm gonna go home to my 4 kids. My wife said it's fine, so go home. I've been getting texts about this from my kids complaining, so I need to head out.
Awesome. All right. Well, have a great night, everyone. Thank you for attending.